Welcome to the Robust Referral System training. This training was designed for clergy participants To Heal the Wounded Soul. To Heal the Wounded Soul is an initiative that's funded by the Duke Endowment and led by Duke Divinity School's Clergy Health Initiative and the Office of Black Church Studies. The program supported clergy by offering retreats for rest and reflection practices to promote positive mental health. The program also offered the opportunity for clergy and lay leaders to work together to build a robust referral system to help support them in their leadership of their congregation. This training that we're viewing today was designed by Jessica Stokes with partners in Health and Wholeness, which is an initiative of the North Carolina Council of Churches designed to bridge issues of faith, health, and justice. And one of their focus areas is mental health advocacy. My name is Shalise Overy. I'll be leading this training today. I served as the co-director for To Heal the Wounded Soul, and I had the pleasure of leading this training with many of our clergy participants and lay leaders in their congregations. To Heal the Wounded Soul participants consisted of clergy who were Black, Indigenous, or people of color in North and South Carolina. This two-part training was designed for those clergy and their lay leaders. So you may notice that some of the references or resources are for a particular context or a particular region, but we believe this to be valuable information for church leaders in any part of the country. So let's get started. So here's what we're doing today. First, we're going to explore what a referral system is and why it's important. We're going to help you assess the needs of your congregation and begin the process of developing a ready-to-go list of resources. So let's start with some definitions. A referral is simply an act of referring someone or something for consultation, review, or further action. Implicitly, you would offer a referral when what a person needs is beyond your capacity as an individual or the capacity of the institution to be able to help them or to do it well. When we talk about a robust referral system, we're really talking about a system that efficiently utilizes a ready-to-go list of resources that can potentially help the wide and various needs that you might experience people having in your congregation. Now, why is this important? Several reasons. The first is that this is life-saving, really. In part 2 of our training, we'll talk about how to recognize when a referral is needed, when someone is in crisis, and what to do if someone is in imminent danger to themselves or is a danger to someone else. Knowing what to do and who to call in those moments of crisis, which clergy and faith leaders are often confronted with, can help to save lives. Also, our faith has the ability to bring wholeness in every area of a person's life. Jesus said, "I came that you might have life and have it more abundantly." And so we can help people live holistically abundant lives by attending to the needs of the whole person through referrals. In addition, church is a place where we should be able to be honest about who we are. Removing stigma around what people are facing is a big step in encouraging the authenticity that is needed for people to experience real transformation, which is often what we say we want to happen for people in communities of faith. Our faith encourages us to lean on one another and to help one another, to turn to each other in times of need. And the referral system equips us to better respond to the various needs that individuals in our community might have. So it helps us to live out what the scripture asks us to do when it admonishes us to bear each other's burdens. And faith communities, and this is all really kind of a theological framework for this, which may be helpful as you present it in your congregations, but faith communities really have an opportunity to kind of reverse the narrative, to promote compassion instead of the stigma that keeps people from seeking out help and therefore receiving healing. Now, there are several other reasons why this is important. For one, the professional training of a clergy person usually does not require clinical training. And so there are limitations to the ways that we are able to help people. Having a referral system and being able to refer people out then helps prevent burnout. Then we don't feel like we have to figure it all out and do it all ourselves. And in fact, we aren't necessarily equipped to do it either. Referrals efficiently help the person in need while protecting the boundaries of the faith leader. So when you have this ready to go list, you can help the person quickly and efficiently get to the right place for the help that they need. It empowers other people in the congregation because depending on who you designate to be able to make referrals, other people can potentially connect folks to the resources that they need without even involving the pastor of the church. The pastor then is less involved in this triaging mode, which kind of protects their time and their ability to manage it. They don't have to figure out solution every time a problem comes because they have a list of solutions available to them that they can just use and pull on in those times of need. And the reality is, having this referral system really could not come at a better time because COVID-19 has really exacerbated so many of the challenges that we already saw in our communities. And so people are experiencing a greater need for specialized health treatment and mental health support and financial resources and the like. So really, we could not be creating this resource at a better time. So while this resource is for all types of needs, this training does place a special emphasis on mental health. And as I mentioned, there can be stigma around mental health in communities of color and faith communities in particular. So now we're going to take a moment to hear from theologian and psychologist Dr. Tanya Armstrong about the importance of mental health in communities of color and communities of faith, and some of the specific challenges that arise in these communities. So pause this video now to view the supplemental video that has been provided for you. And after you're finished, spend some time answering the questions found on page 7 of your training guide. Welcome back. Now it's time to start developing your referral list. Remember, the goal of this list is to have a ready-to-go list of resources that can provide help for the wide various needs that a person can have. We have offered a guide to help you develop a pretty expansive list, but you can use the questions that you answered earlier to determine which needs are most important for your congregation, and then place your focus on those. What we've provided here, or the guide that we provided here, is not exhaustive. So if there are other areas that you want to add, feel free to do so. You are the experts when it comes to your congregation and your context. We have made space for mental health professionals and health specialists, for those who offer guidance like job training specialists and spiritual directors, and professionals who help individuals navigate systems like the legal system, educational system, or even the transportation system. There's also space for group support for those dealing with substance use, grief, experiencing significant life changes, or any number of things. And finally, there's a space to fill out support like hotlines, treatment centers, food pantries, and shelters. So what I want to invite you to do now is to pause the video again to complete sections 1 and 2 of worksheet 1, developing a referral list. If people are present from multiple congregations in this training today, allow them to meet with other members of their congregations in small groups. So break up into small groups made up of members of your congregation. And if all participants are from the same congregation, you may just remain in one larger working group. Pause the video here and get to work. As you return, I hope that you've had a good time brainstorming some ideas and people who can help you really develop a full and robust list. And while referrals from trusted individuals are preferred, these resources on your screen can help you identify professionals and organizations in your area to help complete your referral list. Keep in mind, all of these links are available to you in your self-guide. The links that you're looking at now are really helpful for faith leaders looking to learn more about mental health and how to navigate it. And you can explore these links to see if these organizations have affiliates in your area. And again, all of these links can be accessed from your training guide. Well, the possibilities of promoting healthy practices, self-care, and normalizing things like therapy and other mental health support are really endless with this system, and so many other things as well. I invite you to pause the video now and take this opportunity to name some of the fears that might come up. Even as important as this is and as helpful as it might be, what are some of the fears that might come up for you as you consider implementing this in your congregation? What are some challenges that you might anticipate? So we just want to allow you to name those things and then to use the wisdom of those gathered here in this training to help you to think about how you would address these fears and overcome any barriers as you develop and look to implement your robust referral system. Thank you so much for sharing this time with me and with each other. I encourage you to use the remaining time to answer any questions that are coming up for you as you prepare to compile your referral list. And you'll move on to training 2, not today, not right now, but you can do it either on the same day that you reconvene to compile your referral list or sometime after, but it should be in about 2 to 4 weeks. To give you enough time to begin to fill out that list, but not too much time for you to forget about it. So I look forward to gathering with you again in a few weeks. See you then.